Okay, our last form of treatment is going to be the neuroscience approach. And there's really a growing emphasis in American psychiatry on biomedical therapies because we have gotten so good at making and using psychotropic drugs, which are also psychiatric drugs. So psychotropic means acting on your thinking, feeling, and behavior. Look at this. Currently, about 1 in 5 adult Americans take psychotropic drugs, something that affects your mood, your thinking, and your behavior. So if we were in class, I would have you use your clickers right now and tell me how many of you use a medication that helps with your mood, your thinking, and your behavior. And we would see if our class compares to this really amazing suggestion here. So psychopharmacology is the field of study that examines the effects of therapeutic or psychiatric drugs. But cosmetic psychopharmacology is a new term, and that's the use of medication to produce a desirable personality. So when we say desirable personality, whatever your culture says is a good way to be is what is desirable. Our culture says that it's good to be outgoing, able to communicate well, able to engage with people. And if you are not that, then there are medications that can help you overcome your anxiety, overcome your negative thinking about what it would mean, what risk you would be taking if you did engage with people, and that would be modifying your personality. It would not be a necessary medical intervention, but it would be a desirable intervention to help your personality be more like what your culture defines as successful. Okay, so types of biological treatment, and you're just going to be familiar with these, so I'll just go through them. Drug therapy, electroconvulsive therapy, psychosurgery, very rarely used, eye movement desensitization and reprocessing, we'll explore that. Magnetic therapy, there's not a lot of data about that. And of course, you can influence your biology by what you eat, whether you exercise, meditating, relaxing, sleep, so you can do natural things to be doing therapy from the neuroscience perspective. Okay, so psychotropic drugs are used in treating many types of psychological disorders. They act on neurotransmitter systems in the brain, like we talked about. Major classes of them are anti-anxiety drugs, antipsychotic drugs, mood stabilizers, and antidepressants. So something that works on anxiety, psychosis, or depression, and something to stabilize your mood. There are many, many people who take one of these and then also one of these, or an anti-anxiety and an antidepressant, or an anti-anxiety and antidepressant and a mood stabilizer. So we have a multi-drug approach, and you guys see that on commercials where it says, hey, is your medication for your bipolar 1 disorder not working super well? How about adding Abilify to it so it will work even better? There's lithium and other drugs to treat mania and mood swings in people with bipolar disorder, and now we have commercials about it. So anti-anxiety drugs, the ones that combat anxiety and reduce that muscle tension, by reducing your nervous system activity, have the potential to go too far and make you lethargic and not very motivated and stuff. So you have to have the right dosage, but that's Valium, Xanax, Halcyon. Those are some of the classes, names of drugs in this category. But there's rebound anxiety, the experience of strong anxiety following the withdrawal of basically what is a tranquilizer. So we always have to watch out for that. And antipsychotic drugs, which are also referred to as neuroleptics, they treat schizophrenia and other psychotic disorders. So if you have psychotic depression, if you have mania that is in the range of psychotic with your bipolar disorder, you might take a neuroleptic. So this, though, is a modern miracle because this has allowed people that are pretty severely disturbed that used to be in physical restraints. Now they don't need long-term hospitalization. Better living through chemistry. This is a classic example. But there are side effects that you can have muscular rigidity and tremors and stuff like that, which are not good, and they can last forever. Antidepressants, four major classes of antidepressants are tricyclic antidepressants, monoamine oxidase inhibitors, selective serotonin reuptake inhibitors, and serotonin norepinephrine reuptake inhibitors. Remember when we were talking about reuptake? These are the ones that prevent the reuptake so the molecules of serotonin and norepinephrine can stay out in the synaptic gap long enough to be picked up by the receiving neuron so that an action can take place and you can have a positive thought. So these are used to treat depression and other psychological disorders like panic, social phobia, OCD, bulimia by affecting the activity of neurotransmitters in the brain. So ECT, classic movie. Who knows what this movie was called? Have you got it? So in electroconvulsive therapy, Randall P. McMurphy, the goal was to cause a seizure because they figured there was something wrong with his brain. Now, what you see in that movie is he kind of got this as a punishment rather than a treatment for problems in his brain, but they interpreted his schemes to do things in the mental health facility more as problems in his brain than just willful disobedience. ECT is used for severe depression when drugs and all other therapies have failed. You got it? One flew over the cuckoo's nest. Okay, so this is a real patient experiencing ECT. It's helpful in severe and prolonged depression that doesn't respond to any other form of treatment. But it's still controversial because we cannot explain exactly what happens. So it's a treatment of last resort, and I had an 18-year-old that became toxic on her medication for her bipolar disorder, and to get a child approved for ECT goes all the way to the level of the state. But because she had such terrible depression with her bipolar disorder, they approved ECT for her even though she was only 18. Okay, we don't know about this yet. This transcranial magnetic stimulation, there's an electromagnetic coil placed against your scalp. It's used to create electric currents that stimulate nerve cells in the region of the brain involved in mood and control and depression. So here's a person receiving it, but we don't have a lot of data on whether this really works or not. But we do have some fantastic data on eye movement desensitization and reprocessing, EMDR. This is a very effective treatment for people who have experienced any kind of trauma. Therefore, it's very popular for use with our veterans. It also is used with people who've experienced sexual assault or any other kind of trauma. Step one is called review. You identify the issues and develop a treatment plan. Step two, you prepare. Create a safe place and learn self-soothing. Step three, you desensitize. You conduct bilateral stimulation. That means both of your hemispheres of your brain are stimulated at the same time, and I'll talk about how they do that. Then you react to new insights and associations, and you continue until the disturbing emotion is reduced. Step four, identify disturbing events, identify associate emotions, create positive beliefs. So what that looks like, here's a very simple description. You're bilaterally stimulating both sides of the brain. You can do it by having a person be tapped on alternating shoulders. You can do it by having them look at a light bar. You can have them do it by holding on to alternating, pulsing little devices in your hands. You can be tapped on your knees as long as both of your hemispheres are getting stimulated at the same time. So here's a light bar. You would follow the lights to the left, follow the lights to the right, while you're talking about a significant trauma. Now, I was pretty skeptical about that at first too, but we had a woman who does a lot of EMDR come to two different women, two different psychology discussion groups, and both of them were extremely convincing. Of course, I have to mention psychosurgery, but it's not used very much. It's even more controversial than ECT. rarely practiced today. But they used to do lobotomies, and I have a lot to say about that, but we no longer do them, so you don't need to know that much about it. Then there was an attempt at psychosurgery involving like 100 cocaine addicts in South America. They actually removed a portion of the brain they thought was involved in the addiction. There's no success. All those people stopped cocaine for a little while, and then all of them went back to using cocaine. There's an example of Tourette's syndrome where they do some brain surgeries to stop the tics, and that's more of a psychomotor problem, though, than an actual psychological problem. And a lot of you watched MTV and saw the gal who was really mean to her mom all the time. She would cuss out her mom and stuff, and so she had brain surgery, and it lessened it a little bit, but she was still cussing out her mom. So, eclectic therapy. This is the most common kind of therapy. It is an approach to psychotherapy that incorporates principles or techniques from various systems or theories. It's the most common form, and the most common form of it is cognitive behavior therapy. You're combining the cognitive approach and the behavior approach. You could combine humanism and psychodynamic. You could combine psychodynamic and behavior. You could combine neuroscience and any of the other approaches. As long as you're combining more than one approach, you're considered to be eclectic. The most significant factor in successful therapy is the relationship between the therapist and the client. So no matter what techniques the therapist is using, no matter what theoretical framework they counsel from, no matter what college they went to, what license they have, the most significant factor in the success of therapy is the relationship, or it's called rapport, between the therapist and the client. So if they get along well, it doesn't matter what kind of therapy they get. Okay, so empirically supported treatments, empirically means research verified treatments. So conditions where the treatment is effective, you've got this table in your book so you can spend more time looking at it. But cognitive therapy helps with headache, depression, OCD, and anger issues. Behavior therapy helps with depression, developmental disabilities, and believe it or not, bedwetting. Cognitive therapy helps with panic, generalized anxiety, bulimia. Exposure helps agoraphobia and specific phobias. Exposure and response prevention helps obsessive compulsive disorder. Interpersonal therapy helps with depression and relationship problems. Parent training programs help with children with oppositional defiant disorder. So those are some of the approaches that are verified empirically. Hey, guess what? We've made it to the end, and it would be time for your quiz here.